And welcome back. Well, pain can bring life to a halt, but our next guests say you don't have to live with that pain anymore. Dr. Dane McCullough and Kristina Bjorkman are here from the Spinal Rehabilitation Center of Lake Geneva to chat about spinal decompression for people who suffer from neck pain, back pain, and sciatica. And I think those terms just make people listen, right? I mean, I don't know anybody who doesn't have some back pain, but these are very debilitating problems that you guys deal with on an everyday basis.
Yes, yeah.
It takes people away from doing, I think, their regular life. So what is it that usually causes neck and back pain?
Okay, so low back pain and neck pain can kind of be caused by kind of a myriad of different things, whether it's an injury, so an auto accident, or a slip, fall, or any type of degenerative process, so age-related as well. So what happens is you've got your spinal cord that's protected here by your bony
We'll get
vertebra.
a shot of this right over here so that we can see it.
So
you can see, so tilt it a little.
All right. Spinal cord itself is protected by the bony vertebra, and in between each one of those.
So this is the spinal cord, the yellow thing. Okay.
And then the vertebra are the clear things on this model.
Okay.
They're protected by that bony vertebra, and in between each one of those, you've got a soft disc that's surrounded by a ligamentous layer on the outside. A lot of the low back and sciatic issues are caused by disc issues. So what happens is that the disc kind of acts as that shock absorber for the spine itself, and then what happens when that kind of deteriorates, you might get a herniation, a bulge. So when that pushes out.
Keep holding that till we get a shot.
Okay.
So that's the bulge.
Herniation or a bulge puts pressure on that nerve, and then you get that numbness, that tingling, that pain that goes on the arms, the legs, wherever the issue is. So
there's a lot of different conditions that you guys can treat. We've got a whole graphic of all these different things because I think people they're going to think bulging disc, low back pain, muscle spasms, all of those types of things, the shooting hip and thigh pain, headaches, arthritis, dizziness, numbness, all of those things that you can treat with spinal decompression. So how does spinal decompression work? What exactly is it?
So spinal decompression is a state-of-the-art treatment, and what it does is it uses a distractive force to help take that nerve compression that we talked about with the disc-related issues. So it helps treat, like I said, sciatica, degenerative disc disease, any type of pain that's caused by that pressure on that nerve. And actually, since its release, there have been many case studies, even from such places as Johns Hopkins and Mayo Clinic, that have proven the immense effectiveness of this treatment at treating those conditions with the decompression.
So I imagine, because I know you guys look at MRIs, you come in, you're going to find a specific disc or spot that's kind of compressed. So how do you get in there and get the specific ones to sort of decompress? Okay,
so when we use decompression, it uses both a spinal positioning, so we get your spine lined right, and then we use a varying degree as well as intensity of the force to help target that specific disc. And then the key to spinal decompression really is how we use the gentle pull that's created by a logarithmic curve. Using that logarithmic curve creates a gentle force that allows the muscles to relax and it kind of bypasses that muscle guarding reflex.
Sounds nice.
By able to, yes. So by bypassing that muscle guarding reflex really is what helps allow that true spinal decompression to occur.
Anybody who's been in physical therapy has heard you're guarding with that muscle reflex, and that's just your ability to kind of like be nervous, right? What's the difference between this and traction? Because I've had traction, a lot of people I know have used traction. Are they different?
Yes. So kind of with that muscle guarding reflex, that traction doesn't, and even like an inversion table, kind of are trying to do what the decompression table does, but it doesn't bypass that the muscle guarding reflex. So that's like I said, the key to decompression is bypassing that reflex. So neither the traction or the inversion table can actually bypass that reflex.
Kristina, how long does it take to see results?
Most patients see it within the first 2 weeks. After 2 weeks is when most patients do see results.
After one treatment, or is that multiple treatments?
Patients come in 3 times a week for 4 weeks, but after the second week, most patients, that's when they see their results. A lot of patients do find pain relief while they're on the table during the day. So most of the patients fall asleep while they're on there. So we won't tell you if you're snoring before you leave, but
it'll be our little secret, right?
Yes. At least probably once a day. There's somebody else and I'm like either doing paperwork or treating a patient, and all of a sudden I'm hear snoring in the background.
Because you haven't slept for so long either, because it hurts to sleep, right?
And then when they're on that table, it's taking that pressure off that nerve, so that's actually the time where they feel the most comfortable throughout the day.
How long does it take to complete the treatment? Because if you're saying, you're doing these multiple treatments the first couple of weeks, how long before you're finished?
We have different protocols, so it kind of depends on where you are at with your disc and your pain and that. So, but after we do 4 to 12 weeks is when each protocol is. So I would say about 4 weeks. Yeah.
Are there any risks involved?
There's no risks involved. Kind of like we talked about, it's very comfortable. At this time, there's no risks involved. They kind of just fall asleep at the table. It's so comfortable. Like I said, they just feel better. They go on the table, they get the treatment, and they feel better.
Real quick, can someone who's had a spinal surgery still partake in your treatment?
Yes, there's no contraindications for like laminectomies, microdiscectomies, bony fusions. Actually, it helps a lot of times with failed or relapsed back surgeries. People find a lot of good results with that as well.
All right, if you need some relief with your back, your neck, your sciatica, there's a free consultation right now or MRI reviews if you call at 262-248-4105, Spinal Rehab and ChiroCenter.com, again, located in Lake Geneva. Thanks so much for being here, you guys.
Thank you.
Thanks for having us.
Sounds great. I love it. All right.